I'm a pediatrician by profession, and I qualified from the University of Delhi. Did my residency in pediatrics, and then decided to start this organization called Asha, which means hope in Hindi. And I entered the very first slum in my life in August of 1988, 25 years ago. The health status is very poor. The infant mortality rate is 100 for every 1,000 live births, roughly. Child mortality is about 150 for every 1,000 live births. The sex ratio in Delhi itself is 866 girls to 1,000 boys. It can be even worse in some other parts of the country. And they have severe environmental disadvantages, problems with water and sanitation, and education, of course.
In the case of this program in Delhi, the need for slum dwellers to be in front of doctors couldn't be met through normal means. Medtech was identified as having the technology that would enable this to happen through telemedicine, and a relationship was established between Tier Fund and Medtech. This program was approved by the New Zealand government.
This is a fantastic project to be involved in, partly because it's got a huge human dimension. It changes lives, and that's a very satisfying thing.
Implementing technology in difficult conditions where the power, the electricity, the network is very difficult in an environment that is harsh would make our product very strong, so that when it comes to the developed world, it is proven to work automatically. So it is a testing ground for our product to go to the hard grind.
It's really, really hard to get health professionals to work in these communities. Doctors are very difficult to find who would actually be willing to go and sit there in those slums, surrounded by all the difficulties and the challenges of that environment, and to see patients. And what I think is that technology can really become very useful there, because if you have a place where doctors are available, and then you have centers in different slums that are staffed by nurses and paramedics, and the doctors can communicate via technology and bring the accurate diagnosis to the patient, and then make sure that proper treatment and care is given to the patients.
I see healthcare innovation in emerging markets being very important, because within those markets, they have a deficiency of healthcare providers. And technology, innovation will help provide services and help move services out to those individuals who normally would not receive it. And so we're able to keep people healthier and satisfy their health needs better.
We worked out a way through using their technology that patients could be seen by a doctor via a cell phone internet link, and with the equipment that is much like a normal doctor uses, but it actually plugs into a small box, and with the aid of a video link enables the doctor, with the help of a nurse, to perform just about all of the functions that would normally happen in a normal examination.
I think what's unique about this product is the fact that it is a platform which integrates audio, video with device integration. Devices meaning you can measure your heartbeat, you can measure your blood pressure, you can take your blood sugar, you can take your ECG, and so on. And it enables remote care, because a patient could be using his iPad, could be using his Android, or even his smartphone. So it's a very unique platform which brings all of these strings and converge them under one framework.
Telehealth, remote monitoring, video connectivity, electronic health records are all going to become more seamless, more transparent, more interoperable, connecting with more sources so that more people have access to that information to improve your outcomes.
For this new project, I have great hopes that the thousands of families that are going to be helped are going to be the drivers of change from the front. They're going to be at the steering wheel, and we are going to be the ones who are going to facilitate the change.